Okay. Hi guys, once again. So we are back with renal physiology. So in this specific section, we are now going to discuss on the regulation of acid-base balance function of your kidneys. Now, before we go to this part of the slide, I would like you to understand more on ABG interpretation. Why? We need to interpret your ABGs in order to know if your patient has metabolic or respiratory alterations in acid-base balance, which is the core of explaining how your kidneys will now manage or will respond to these changes in acid and base contents of your blood. All right. So let me first direct you to a drawing actually I made earlier. Okay. So here we go. So this is a summary of the basic ABG interpretation. Okay, so kahit ito lang yung matandaan nyo para sa session na ito. It is very important because they also ask these kinds of things in your board exams, and it will also help you a lot in the clinical setting. All right, so before we go to the actual um, interpretation, okay, we are going to first understand the concepts behind your metabolic and respiratory alterations in acid bases. Okay, so para mas matandaan ninyo, we will try to put a story into it. Okay, patalastas lang. Okay, so here we go. In this story, we have two main characters. We have your kidneys and the lungs. So sila yung main characters in the story. Now, in the story, your lungs and your kidneys are best friends. So, beshies sila. Anong ginagawa nila? Uh, Lagi nilang ginagaya ang isa't isa actually. Okay. So, si kidney, siya ang bahala sa metabolic. Si lungs, siya naman ang bahala sa respiratory. Okay. Although naggagayahan sila parate, magkaiba sila ng kinokontrol na substance. So, si kidneys, ang kinokontrol niyang substance is your bicarbonate, which is HCO3. Si lungs naman, ang kinokontrol niyang substance is yung carbon dioxide. Okay. So, paano nila ginagayang isa't isa? So, for example, si lungs, tinaasan niya ang carbon dioxide niya, yung kinokontrol niyang substance. Ginagaya ngayon ni kidneys, tinataasan din niya ang kanyang kinokontrol na substance, which is your bicarbonate. The same thing is true for the reverse. Kapag binababaan ni lungs ang kanyang carbon dioxide, binababaan din ni kidneys ang kanyang bicarbonate. So bakit nila ginagawa yon? So di ba nga mag-best friends sila? So they are trying to maintain their friendship. So yung friendship nila, ipagpalagay na lang natin na yun yung pH. Okay. So, yun yung story natin ha. Now, we have several steps in your ABG interpretation. So, I have created 6 specific steps for you. Basics lang. Hindi na natin masyadong ookokin yung iba pang interpretation kasi it's not within your level. Okay. So, we have 6 steps. The first step is to check the pH. Okay. Check the pH as compared to normal. Number 2, compare your carbon dioxide and your bicarbonate from normal as well. Number 3, you are now going to match your carbon dioxide and bicarbonate changes from your pH. Okay, and that will lead you now to number 4, which is the determination of the primary disorder. Kung ano ba siya? Metabolic, acidosis or alkalosis, or respiratory acidosis or alkalosis. So those are your primary disorders. Now, step number 5, ipre-predict mo ngayon kung yung compensation ng isa sa mga beshes is appropriate or not. Okay, ano ba yung compensation na sinasabi natin? Balik tayo dun sa kwento. Okay, so balikan natin. Di pa mag-beshes. Sabi ko kanina, naggagayan sila parate. So for example natin, mataas ang carbon dioxide ni lungs. It is expected na si kidneys gagayahin niya by increasing your bicarbonate. Laging tatandaan, this is the important concept. Huwag kayong mahihilo dito, huwag kayong mako-confuse. Pag pataas sa kabila, dapat tataas din sa kabila. Kapag mababa, bababa din doon. Kahit magkaiba ng values, that is the expected na gagawin. Okay. So, yung expected na gagawin ng isa is what you call now your compensation. So for example, yung example natin kanina, tumaas yung carbon dioxide ni lungs, nagko-compensate ngayon si kidneys by increasing also your bicarbonate. Now, what your number 5 identifies, however, is the appropriateness. Anong ibig sabihin? So, it is expected na tataas dapat. Yung example natin kanina, mataas yung carbon dioxide ni lungs, so ina-expect mo ngayon. You're just expecting pa lang na tataas din ang bicarbonate ni kidneys. Pero in the event na kulangin yan, okay, that's the time na sasabihin mong inappropriate yung compensation niya. Or for example, na-meet naman niya yung target mo na pagtaas ng bicarbonate, then that's what you call appropriate. Okay. So yung appropriateness natin, mini-measure lang niya kung nagkulang ba or sumobra or tama lang yung response ng isa sa kanila. Okay. And what is the last step? Number 6, you will now interpret the whole thing. The acid-base disorder and the degree of compensation. Now, before we can actually proceed to these steps, there are certain things na kailangan mong matandaan. Okay? Certain values na kailangan mong i-memorize. Okay? So, una, it's one of 3. Tatlo lang naman i-memorize mo na parameters. So, yung tatlong yun yung pH, carbon dioxide, and bicarbonate. Okay, unahin natin yung pH. So your pH is actually a measure of your blood's acidity and alkalinity. Okay, kaya pH kasi power of hydrogen. Now, anong ibig sabihin ng power of hydrogen? Okay? Kapag masyadong maraming hydrogen ions, okay, a positively charged substance in your blood, kapag masyadong maraming hydrogen, okay, nagiging acidic yung blood. Okay, do not confuse the one I just mentioned from the values. Huwag nyo munang isipin, takpan nyo muna yung 7.35 to 7.45 dun sa sinabi ko. Ang isipin nyo muna, kapag maraming hydrogen, mababa ang pH. Kapag maraming hydrogen, mababa ang pH. Kapag kulang ang hydrogen, mataas ang pH. Okay, so that is the concept. So any disease that increases now or diseases or conditions that will increase hydrogen ions in your blood will now tend to decrease your pH. And the same thing is true for the reverse. Okay, so alterations in hydrogen, either acidic or alkalotic. Now, eto na. You should now memorize the normal values of your pH. So the normal value of your pH is 7.35 to 7.45. Okay, ang sabi dito, kapag more than 7.45, the pH is alkalotic. And if it's less than 7.35, the pH is acidic. Okay, so paano nangyari yun? Akala ko ba kanina hydrogen is Kapag madami, acidic. Bakit parang yung level ng pH mo naman kapag mas marami, alkalotic. Okay. Well, that's because magkaiba yung power of hydrogen tsaka yung amount ng hydrogen. Those are two different things. Ang sinasabi ko kanina is yung amount na mataas, nagiging acidic. What I am telling you now is yung pH naman. Okay. So don't confuse these two things. Laging tatandaan. Okay, ganito na lang. Basta ang i-memorize mo na concept kapag magko-compute ka ha, is yung 7.35 to 7.45 na alkalotic tsaka acidotic. Okay, yun na lang muna. Alright, now we move to the second parameter, which is your pressure of your carbon dioxide, now measured in millimeters mercury. So the normal value is 35 to 45. Okay, kapag more than 45, it's acidic. Kapag less than 35, it's alkalotic. Okay, so ma-observe mo magkaiba na sila from your pH. Okay, pero yun, ganun yun. I-memorize mo na lang. Okay, pag madaming carbon dioxide, isipin mo, this is something that is bad, kontrabida. So, isipin mo na lang na kontrabida. Kapag masyadong marami ng kontrabida, masyadong acidic, masyadong toxic. Okay, kapag konti naman yung kontrabida, nagiging alkalotic. I put it that way or anything na maisip ninyo. Basta, gano'n. Okay, third parameter, your bicarbonate. So your bicarbonate normal values is 22 to 26. Okay, anything more than 26 is alkalotic and anything less than 22 is acidic. Okay, isipin mo lang siya yung good guy kasi ito yung member ng buffer system ng katawan mo. Binabind niya, nakikipag-bind siya sa hydrogen. Okay? Para ma-excrete mo si hydrogen from your system. So that's the work of your buffer system. Binabind niya yung maraming hydrogen ions in the blood and then excretes it in your urine. Alright, ulitin natin. Anong normal values? 7.35 to 7.45 your pH. Madali lang tandaan ang carbon dioxide. Tatanggalin mo lang si 7 from your pH. Nagiging 35 to 45. Now, eto na lang ang tatandaan mo, si 22 to 26. Okay. Pero, yun yung normal values. Kaso nga lang, may mga magic numbers tayo. Ano yung tinatawag nating magic numbers? Sila yung mga median. Median. Yun, median. Nasa gitna. Kasi sila yung gagamitin mo para sa pag-compute ng acid-base disorder. So, anong nasa gitna ng 7.35 to 7.45? It's your 7.4. 35 to 45, ang nasa gitna, median niya is 40. And then, for your bicarbonate, 24. Okay, magic numbers, 7.4, 40, and 24. All right, so let's proceed now to a case para mas maintindihan natin. Okay, so may pasyente tayo ngayon. So, yung patient natin, anong problema? 20-year-old male na ang complaint niya is diarrhea. So, nagtatae. So, pumunta siya ngayon dun sa hospital. Nag-order ka ng arterial blood gas analysis, ABGs. Bumalik sa yung result. Ano yung result? Okay. So, lumalabas ngayon na yung pH niya is 7.32. Yung carbon dioxide niya is 28 and yung bicarbonate niya is 14. Now, balikan natin yung steps natin. Okay, so first step. What is our first step? Check the pH. Okay, so titignan natin yung pH from the normal value. Yung pH natin, ang value niya is 7.32, di ba? I-compare natin ngayon dun sa magic number ng pH. 7.4. Okay. So, mas mababa, mas mataas. Mas mababa. 7.32 is less than 7.4. So, anong gagawin mo ngayon? Ile-label mo siya as either acidic or alkalotic. So, since the actual value of your pH is less than our magic number, It is acidic. Okay, so ile-label mo yan, number 1. Yung pH mo is acidotic. Alright, now, step number 2. Titignan mo ngayon yung carbon dioxide and your bicarbonate na values. And i-compare mo pa rin sila from the normal value, which is your magic number. Okay, unahin natin si carbon dioxide. So si carbon dioxide, ang actual value niya dun sa pasyente is 28 lang. Okay, si 28 ngayon, i-compare mo dun sa magic number natin ng carbon dioxide, which is 40. So, ano siya? Mas mataas or mas mababa? Mas mataas or mas mababa? So your value of 28 is less than 40. Okay. So anong ibig sabihin nun? Then it is alkalotic. Okay. Sulat mo ngayon. Carbon dioxide, less than 40, alkalotic. Alright. Now, we go to bicarbonate. So yung bicarbonate niya is 14 lang. 14 mex. Mole equivalents per liter. Eh, anong magic number natin sa bicarbonate? Ulitin natin, tignan natin. Magic number is 24. So your value of 14 versus the value of 24, magic number 24, ano, mas mataas, mas mababa yung actual? Mas mababa. Okay, so kapag mas mababa, ang i-interpret natin is acidotic. Alright, susulat mo yun ngayon. Bicarbonate, less than 24, acidotic. Alright, so we're done with steps 1 and 2. Now, ano yung step number 3 natin? Sabi natin kanina, you will now match your, ang arte no, match. Okay. You will now match your carbon dioxide or bicarbonate with your pH. Okay. So, titignan mo kung sino yung magkaparehas. Madali lang naman tignan, di ba? So, si pH tsaka si carbon dioxide, parehas ba? Hindi. Acidotic si pH eh. So, maghahanap ka ng kaparehas niya, si bicarbonate. Okay. So, nahanap mo na yung mag-match. Ang mag-match ay si pH tsaka si bicarbonate. Parehas silang acidotic. That is your step 3. So, kapag nakita mo na yung nag-match, i-interpret mo na ngayon yung primary disorder. Unang sasabihin mo kung either respiratory or metabolic. So, since si bicarbonate, yung kamatch ni pH, metabolic. And since si pH ay acidotic, yun ang isusulat mo ngayon. That's why you will have the primary disorder of metabolic acidosis. Okay. So, di ba nga, madali lang ang steps 1, 2, 3, and 4. Di ba? Madali lang i-identify ang primary acid-base disorder. Pero now, let's try to see step number 5. Titignan natin ngayon kung tama ba yung pag-adjust na ginawa ng Beshi, ng mag-Beshi. Okay. So, in this case, metabolic acidosis, sinong may sakit? Si lungs or si kidneys? Presumably si kidneys. Kasi nga, siya yung bahala sa metabolic component, right? So, let's say for example, may sakit si kidneys. Alright. Magko-compensate ngayon si lungs, hindi ba? Okay. So, since acidotic, ibig sabihin, mababa yung bicarbonate ni kidneys. Ang ini-expect mo ngayon na compensation na gagawin ni lungs, bababaan din niya ang kanyang carbon dioxide. Okay. So, alam mo na dapat babaan ni lungs yung kanyang carbon dioxide. Pero, by how much? So, that is now what your what your step 5 is for. Iko-compute mo kung ano ang appropriate na compensation. Okay, in your compensation, we have a cheat sheet na tinatawag namin. Kasi medyo mahirap i-memorize. Pero, sulat mo lang You are not required actually to memorize them. Pero kung ma-memorize nyo, then that's very good. At least, mas madali nyong i-interpret, tsaka mas ma-interpret nyo ng tama with the use of mathematics, yung acid-base imbalance ng inyong pasyente. Kesa naman yung tatanungin lang sa'yo yung primary acid-base disorder, hindi mo na alam yung compensation, di ba? Pero most likely, ang tatanungin lang nila sa inyo sa clinics is yung primary disorder. Now, when it comes to boards, it's a different thing. Malamang tatanungin yung compensation. That's why it's important for you to know yung values dito sa cheat sheet natin. Okay, so focus tayo ngayon sa cheat sheet. Alright, sa cheat sheet, nako-contain kung magkano dapat yung adjustment ng lungs or kidneys for specific instances. Okay, so on our first column, we have here your primary disorder. Okay, on the second column, you have your compensation, kung ano yung dapat na gagawin ng isang character. Okay, and on the third column, you have your computation. What is the expected value? All right. So, nilagyan ko na lang ng abbreviations, but your MAC, this is your metabolic acidosis. Okay? So, for your metabolic acidosis, just like in the case of the patient, mababa yung pH, mababa yung bicarbonate. So, gagayahin ngayon ng kanyang beshi. Gagayahin ni lungs, si kidneys, bababain niya din yung kinokontrol niyang substance which is your carbon dioxide. So, parehas sila ang direction. Kung titignan nyo lahat, yung mag-beshies, parehas ng direction, di ba? Ganun lang din yon. Okay. Yung compensation, yung kabilang beshi niya. Okay, so magkano dapat ang gagawin ni lungs na pagbaba ng carbon dioxide? Okay. So, for every 1 point na decrease ng bicarbonate, dapat bumababa din yung carbon dioxide ng 1.25 points. Okay, remember that. 1 is to 1.25. Okay. Now, second instance, your metabolic alkalosis naman ngayon. So, for your metabolic alkalosis, mataas ang pH, mataas ang bicarbonate. So, tataas din ang carbon dioxide. By how much? 1 point increase in your bicarbonate will require 0.75 increase in your carbon dioxide. Okay. Next, going down the line, respiratory naman tayo ngayon. Respiratory acidosis. If the pH is decreased, the carbon dioxide, yung kontrabida na sinabi natin kanina, mataas. Okay. So, ang beshi niya, tataas din dapat. Mataas din dapat ang bicarbonate. By how much? Every 1 point increase in your carbon dioxide, there is 0.1 increase in your bicarbonate. And lastly, respiratory alkalosis. There's an increased pH, but there's a decrease in your kontrabida. Pababa din ang bida. Okay, so for every 1 point decrease in your carbon dioxide, there should be 0.2 decrease in your bicarbonate. All right. So, ano na lang ba ang tatandaan? Ano yung tatandaan nyo? 1.25, 0.75, 0.1, 0.2. Macmal, Racral. Okay, yun na lang. So, let's try to compute now the appropriateness ng response kanina nung case natin. Okay. So, sabi natin kanina, kailangan mong i-compute yung compensation. May different steps na naman tayo dyan. So, you will now identify based sa cheat sheet na dapat bababa si carbon dioxide ng 1.25 for every 1 point decrease ng bicarbonate. So, titignan mo ngayon muna Ilan ba ang binabaan ng bicarbonate mo? 'Di ba? Yung reference range natin, yung magic number natin is 24 for your bicarbonate. So, bumaba yung actual na bicarbonate ng pasyente to 14. So, ilang points yun? Ilang points ang binabaan ng bicarbonate? So, 24 minus 14, that is 10. So, there's an actual 10-point na actual decrease ng bicarbonate from your normal value. Now, you can compute for the compensation. So, 10 points, you multiply mo yun by 1.25, you will get 12.5. So, it is expected that your carbon dioxide will decrease by 12.5 points from the normal. Okay. So, titignan uli natin yung normal ni carbon dioxide. Magic number, 40. So, 40, tapos tignan mo yung actual na value ng carbon dioxide ng pasyente, which is 28. Okay. So, ito yung actual na nangyari. 40 minus 28, that is 12. Ito yung actual na response doon sa case ng pasyente. Okay. So, there's a 12-point decrease in your carbon dioxide from your normal. Magkalapit lang, di ba? 12.5 and 12. So, appropriate ba? Tama ba yung response ng beshi ni kidneys na silang tama lang. Okay. Tama lang na pagbaba. Okay. So, what does that mean? So, it means na compensated yung metabolic acidosis, yung primary disorder ng pasyente natin. Okay. So, that's how you will interpret all in all. It's a compensated metabolic acidosis. Laging tatandaan, for your step 6, which is interpretation, mention your primary acid-base disorder and mention the compensation. Okay. So, just some important things to note. It's not always that your pH will return to normal with the appropriate compensation. Let's say, for example, tama naman yung na-compute mong compensation ng pasyente, pero bakit hindi pa rin normal yung um, pH ng pasyente mo? Gaya nito, nag-compensate naman pala si bicarbonate. So, tama naman pala ginawa niya. Bakit yung friendship nila parang medyo-medyo pa rin? Bakit less than 7.35 siya? Acidotic. So, that is now what happens with your acid-base imbalances. Saka lang actually bumabalik yung instances na bumabalik yung pH sa normal levels kapag tama yung compensation if it's chronic. Pero kapag acute lang yan, huwag mong i-expect na nag-normalize kaagad yung pH niya. Nasa periphery ng normal ranges, palapit dun sa normal range, pwede pa kapag appropriate yung response niya. Okay, so ibig sabihin nun, malapit na nilang masalba yung friendship nila. Alright, so I hope you will remember that as well as the normal values. Okay, so madali lang, di ba? Remember the 6 steps and you will be able to interpret your acid-base imbalances appropriately. Okay, so let's now go back to our discussion on the kidney's acid-base function. Alright, so balik tayo dun sa slide. Okay, here we go. So an important function of your kidneys is regulation of your acid-base balance. So ang sabi natin kanina, kapag acidotic yung blood, ibig sabihin maraming hydrogen ions. Tama? Okay. Ang ginagawa ngayon ni kidneys, okay, is siya yung taga-secrete ng buffer system. Kaya sinabi ko kanina, important yung role niya kasi siya, ang kinokontrol niyang substance is your bicarbonate. And it is your bicarbonate that is a very important buffer in your body kasi siya yung nagbabind sa excess na hydrogen ions. Okay. So, ang ginagawa niya is nire-regulate niya kung ilan yung ine-excrete at nire-reabsorb na acid. Ano pa? Sine-synthesize na ammonia at yung ine-excrete na ammonium chloride. Okay, siya din ang taga-reabsorb ng bicarbonate sa filtrate. 'Di ba, in the previous video, we have already explained how your important processes, which is your filtration, absorption, secretion, and excretion occurs. So it is the function of your kidneys now to reabsorb bicarbonate, okay? If kailangan ng katawan ng reinforcements in cases of acidity. Alright. So, kung babalikan natin yung picture kanina, let's try to go back to the picture. Picture from the previous video pala. Okay. So, a picture of the nephron. So here, so kapag maraming hydrogen ions ang nasa blood, ginagawa ngayon ng iyong nephron, it will now reabsorb from the tubules, babalik doon sa capillaries para bumalik sa blood. Okay. Para kapag mas maraming reinforcement na reabsorb yung katawan mo, yung through your kidneys, then mas maraming magbabind na bicarbonate with your hydrogen ions. Bakit? Bakit kailangan i-bind ng bicarbonate ang yung hydrogen ions? In order for it to form a complex that will soon dissociate into your water and carbon dioxide. Okay. So, paano yung formula na yon? Okay, let me just type it for you. Paano niya nare-release? Okay, so meron kasi tayong, what do you call this? Equation. Ano yung equation na yun? Free-flowing hydrogen ions, kapag kinombine mo siya sa water, H2O, ano nangyayari? It will now result to, okay, mali. Okay, balik tayo. Carbon dioxide. Carbon dioxide plus water, H2O. Yan. So, ano ang product ng carbon dioxide plus water? You have your carbonic acid, H2, CO3. Correct me if I'm wrong. Okay? Which can later dissociate to your, okay? This can later dissociate to your hydrogen ions. Okay? So, pag babaliktarin mo yung equation, kapag may free ions, kailangan mo ng bicarbonate. Okay? So, kapag babaliktarin mo yung equation, parang ganito. HCO3 plus hydrogen. Okay, di ba? Ang common part niya is yung carbonic acid. This is what you call your carbonic acid. Okay? Ito ang carbonic acid. So, in cases wherein your carbon dioxide is increased, so nakikipag-complex siya with water to form your carbonic acid, which will later on dissociate into your bicarbonate and your hydrogen ions. This also explains why your Increase in carbon dioxide means acidosis kasi yung carbon dioxide eventually, down the line, nagdi-dissociate siya sa hydrogen. And hydrogen concentration, a high hydrogen concentration is associated with acidity. Tama. So, anong gagawin ng kidneys mo? Magpo-produce siya ng mas maraming bicarbonate para mag-complex sa hydrogen at maging carbonic acid na lang. Your carbonic acid will later be sent to your kidneys and then balik tayo dun sa ating kidneys. Okay, here we go. So, yung bicarbonic acid mo pupunta ulit sa kidneys. And what happens is that in your distal convoluted tubules and going to your collecting ducts, this is where your hydrogen ions in exchange to potassium ions are interchanged. Okay. So, ibig sabihin, kapag yung nasa blood mo may carbonic acid and it now dissociates between your and releases your hydrogen ion through your channels, okay, through your specific cells in your tubular system, kinukuha niya ngayon yung hydrogen ion from the blood and dumps it now. And it dumps it to your tubular system para matapon niya sa urine. Okay. Pero it's not as easy as that. Bakit? Hindi mo basta-bastang matatapon sa urine yung hydrogen ions mo kung hindi siya nakikipag-combine sa iba pang buffers. So, ano yung buffers na sinasabi ko? It is mentioned in the last part. Okay, balik lang tayo. Okay, sobrahan. There we go. So, important chemical buffers are your phosphate ions and your ammonia. Yung hydrogen ion mo na nasa tubular system mo na ngayon, nakikipag-complex siya sa ammonia and phosphate ions in order for it to be excreted in your urine. Yan, nandiyan yung statement. Through the buffering process, the kidney is able to excrete large quantities of acid in bound form without further lowering the pH of the urine. Okay. So, in effect, kayang i-regulate ng iyong kidneys yung acid-base disorders by controlling your bicarbonates. Okay? And that is a very important function of your kidneys. So, in disease states that will hinder your kidneys to reabsorb or excrete acid will have a high effect on your body. Okay? So, ano ba yung mga examples natin? For example, yung case natin kanina, metabolic acidosis. Di ba? So, ang may sakit, yung kidneys. Metabolic acidosis, ano yung complaint niya kanina? Is diarrhea. So, naglulus ka ng bicarbonate dun sa tae mo. Okay? So, less carbonate, bicarbonate, it equals to acidosis. Tama? Okay. Now, another thing that you would that is important for you to remember in the relationship between your kidneys and your lungs is that ang mas maraming problema actually is si kidney. Maarte. Mas maraming, for example, kung if I would put it, mas madaling magoyo. Mas madaling maloko si kidneys. Bakit? Mas marami siyang causes ng ng pagkakaroon ng acidosis. Okay. Ano ba yung mga yun? For example, yun nga, nagtatae lang. Ibang system naman yung intestine dun sa kidneys, di ba? So, nagtatae lang. Nag-a-adjust na yung base balance ng kidneys mo, ng dugo mo dahil hindi nakakapag-compensate si kidneys. Okay, ano pa? Kasi metabolic siya, di ba? Ano pa? Remember that um, The bicarbonate could also be affected by, for example, may diabetes yung pasyente. Okay, may diabetes yung pasyente, tapos biglang nagka-diabetic ketoacidosis. So your ketones that are produced from your diabetic ketoacidosis will soon dissociate to your hydrogen ions. So kapag masyadong maraming hydrogen ions, mas marami siyang ire-require na bicarbonate in order to bind it to the hydrogen ion, the free-flowing hydrogen ions in the blood. Okay. So, kapag marami siyang masyadong nagamit na bicarbonate, bababa ngayon ang bicarbonate levels mo and it equals to acidosis. Alright. So, ibang part na naman yun, di ba? So, kidneys, that is caused by your pancreas. Okay. And a whole lot of other things. Alright. But for now, it is just important for you to be able to know the function of your kidney, know the role of your kidney in the regulation of acid-base disorders, and of course, yung computation ng ating ABGs. So yun lang ang takeaway natin ngayon for this lecture. I hope you have learned a lot, and I hope that you will practice your ABG interpretations with sample problems, which I will later send to you. Okay, so keep on reading and have a good day ahead.